you have a lot of neck pain and you just feel like you want to rub it. If that's your story, this video is for you. Hi, I'm Dr. Shaki from Irvine Spine and Wellness Center, your Irvine Chiropractic and Posture Clinic. Stay tuned. All right, you know how at the end of the day you feel like, oh my God, my neck is so sore, and you keep wanting to do this. There's a right way to do this that you actually get some miles out of that rubbing your neck part. So I had Desiree to be my model here, so we're gonna kind of do it together. Desiree, get a little bit closer to me. So right here, as your clavicle, your collarbone, if you trace the collarbone to your chest bone, and you go kind of diagonally up around the curvature of your neck, and you kind of don't move the skin, so you're a little bit deeper than the skin. You just follow that line until you get where the neck, this part of the shoulder is reached, and you just kind of go deep as if it's the base of your neck connected to the top of your shoulder. And you get to a harder part. You feel that, Desiree? And it is usually sore. Yeah. So that is actually your first rib. So there, if you thought your ribs were down here, well, here's the news. There's a rib right here. That's where your first rib starts. Where your neck ends, the first rib starts, and it covers the top of your, or the tip of your lungs. So what you want to do is you want to follow that line around the curvature in your neck from the collarbone, and you get to that very end part, which is just the rib. So the ribs are going this way, like as if I'm choking Desiree. The ribs are going that way, and you're getting right as at this juncture, if this was the rib. So what you're going to do is you're going to get your thumbs. Desiree, do it with me if you can. So get to that part, follow this, go to the end, and then get to that hard part, and not press so hard, but press firmly and hold it there as if you're going straight back with a slight downward tilt to your thumb or to the force. I don't want your arms to be, or your elbows to be out, so bring your elbows in and drop your shoulders here. Bring this down, and you want to open up your hands, your fingers I should say, as if you're cradling your head. I can barely talk, did you notice? So that way, what comes next, there is room for it. So you're going to do it this way, the way I'm showing. Bring your elbows in, your thumbs still on the front of your first rib, and then your hands are opened up so you can turn your head right to left. So what you want to do is, the force is, you're not digging in, you're not pushing your thumb down, you're pushing it down and backward like that. And then you can relax the hands, keep that area nice and firm, and then turn your head all the way as you're holding the rib backward. When you're doing that, what's happening is you're stabilizing that first rib while the last vertebra on your neck is rotating around. If we go over here, maybe we can show everyone. So watch me over here, walk with me right here. Can you come a little closer, Desiree? So what we're going is, this is the neck, this is the area you're going. So you're going around the curvature in your neck, and you're putting your thumb right at the first rib here. Can you see that, Desiree? Right here and here. So you're holding this area with both of your thumbs back. So you're going towards the back wall to stabilize it as you're rotating your head all the way. That rotation allows this seventh vertebra, the bottom of your neck, to rotate right above the first rib. And that's the area where When your neck goes forward, you feel it down here and up here. When you're rotating your head, you hardly get any rotation at that level, and the tension gets built up. So that's how you get rid of that. I like to do it this way, and then I just hold it and I rotate all the way that way and all the way to the right. As I'm going all the way to the right, as an example, I press on the first rib a tiny bit more because I'm expecting the rib to rotate, so I'm kind of keeping it in place firmly. Anyway, I hope you find this helpful. It's a simple thing you can do at home or wherever you are and actually do something productive. Make sure you subscribe to my channel and share this with your loved ones. And if you have any questions, use any method of communication in the description box to contact me. Until next time, take care.